It's 94.7 Blair Radio, our local nonprofit news brought to us by RVR Bank. Want to say again, thank you to sponsors like RVR Bank for helping us be able to bring news, local events, and nonprofits right to you on 94.7 Blair Radio and on our YouTube channel. Today we have Memorial Community Hospital and Health System joining us. Courtney, you have a guest again today.
I do. I have Dr. Moore with me today.
Dr. Moore is here, and just to learn a little bit about you, where are you from, Dr. Moore?
I'm from Omaha originally.
Okay, and so you grew up in the area, you kind of know the area. But you decided to move a little bit north of Omaha. So you went through all your school and everything. You got your board certifications and everything. Decided to come to Blair. That's been a little while, hasn't it?
Yes.
How long have you been with Memorial Community Hospital?
So I first started with MCH in 2016, right after finishing residency, and was here until 2020. And then we moved out of state for a while. And I've been back since October and very grateful to be back.
And what do you specialize in?
So I'm board certified in family medicine with OB, and then I also have a separate board certification in breastfeeding and lactation medicine. Okay,
which goes really well with the OB, obviously. So, and that is a really big deal for MCH because they have gone really above and beyond to be able to provide services for individuals about ready to give birth right here, to be able to do that in very good comfort and be able to have the top-notch care right here in Blair, not having to go to Omaha. And so you're a part of that then?
Absolutely. Yes, I think we offer great services. Having delivered my two children, one in Florida and one at Methodist Women's, I can't say enough how much I value the environment we have at MCH for our moms and babies. Very personalized, very good care, a higher ratio of nurses to patients, lots of great things about it.
And so that is, again, you can do everything right here because you have great doctors as well, which be able to help walk through, right on through the whole process. So OB, you basically you have your family practice and then OB, so you can take care of from forever, right?
Yep, absolutely. So we say from womb to tomb in family medicine, and doing OB, obviously, it gives us even more of a role in that family's life. And we've all experienced situations where taking care of the mom, taking care of a sibling, even a grandparent has helped us provide good care for a family member. Mm-hmm. Really gives you more insight into the patient unless you take care of the whole person rather than just kind of what's in front of you. Yeah,
and has this always been a passion for you?
Definitely. I really loved variety when I was in medical training. I liked a lot of things, but, I like the kind of whole person perspective that you get in primary care and the ability to really get to know those people and take care of them longitudinally, and not just at one point in time.
And do you have capacity to take on new patients at this time?
Absolutely, yes. We're all accepting new patients.
Okay, so again, right here in Blair or the surrounding area, you don't have to travel to Omaha. You can stay right here and get fantastic care. Now, to learn more about that, MCH is doing a lot of different things to be able to reach out. People can come in, take tours, but you have some events coming up, don't you?
Yes. So all of our OB providers have expressed interest in starting up our childbirth classes again. I'm not exactly sure how long it's been since we've done them previously, but we are getting that up and going again. The first one's going to be Saturday, March 22nd at the hospital from 8:30 in the morning till 12:30. Going to cover a lot of different topics. It is free to participate, and just something to note is you don't have to be planning on delivering at MCH to attend this class. Mm-hmm. We do ask that people register ahead of time just so we can kind of have a head count and know who to expect. So that is coming here soon, like 2 weeks-ish.
Yeah, that's right around the corner, isn't it?
Yes.
Springtime, everybody starts thinking about delivering babies, Bill.
Spring is all about fertility, right?
Yeah.
So.
No. Do you want to just kind of go through some of the topics that are going to be covered?
Yeah, so we plan to kind of approach everything, and each class will be personalized for those who are present, so there'll be lots of time for questions and answers. There will be 2 of us hosting each class, and so they will get to meet and interact with 2 of the physicians as well as the labor and delivery staff. The topics we plan to do, the first one kind of prenatal, topics about pregnancy, and then what to expect while in labor. We really try to take a kind of conservative approach to labor and let women make choices about their labor. And so we'll talk a lot about what choices are available and how we handle those things. And then we'll talk about postpartum care, taking baby home. And then the last portion will be on breastfeeding. So people who are interested can stay and attend that. If people are not planning to breastfeed and don't want that information, they'd be free to go. We will also have a tour of labor and delivery right in the middle. And then we'll also have the availability at the very end to do a car seat inspection if they'd like.
Okay. And so then anybody can ask any questions that are pertinent, obviously, to the topic at hand. It's a great time to be able to learn, to ask those questions, especially new parents. Although I would have to say, we, with our fourth child, which was 6 years after we had another child, we thought, we know this. We didn't know it. So, again, it's a good refresher for even those experienced parents to be able to go through, because you never know what you're going to have to do again, right? Mm-hmm. So, again, when is that coming up? That's Saturday, March 22nd, correct?
Yep, Saturday, March 22nd in the morning from 8:30 to 12:30.
And how do people register?
So we have the flyer and everything posted on our Facebook. There is a QR code on it. The link is also posted in the Facebook post. If you don't have that, you can always give me a call and I can get you registered. My number is 402-426-1464. So that's an option as well if you can't find that link on our Facebook. But those are the two ways to get registered. Again, it's free. We just ask that you register ahead of time so we can have an idea of who all's coming and how many people we're going to have. We'll have some handouts for folks to take home. We also have a little kind of a raffle basket type thing with some baby items to give away as well. It should be a lot of fun.
And then you get a tour of like the facilities, the birthing suites and everything like that. So you can actually see firsthand what everything, the quality in what you guys have done to put, MCH ahead of everybody else. So again, get registered for that and contact the hospital with any questions about that. Yep. So then you also have like Lunch and Learn coming up, don't you?
Yep, the March Lunch and Learn is coming up on March 25th. March is Colon Cancer Awareness Month, so this one's going to be all about colon cancer screening, symptoms, risk factors, all of those things. Three Rivers Public Health Department is actually going to be the one presenting at this. And one thing that they also have available in case folks are interested, they do give out free colon cancer screening kits for men and women ages 45 to 74. So I know they'll be talking a little bit about those and probably have some available if anybody is interested in that. Obviously, the gold standard as far as colon cancer screening is the colonoscopies, but there might be some barriers for people that is preventing them from getting that, if it's insurance or cost and all of that. These kits are kind of a option for those folks.
It's also a supplement, I would say, because you can get your colonoscopy every 5 years or whatever they recommend. Then in between, you can do the kits.
Yeah. So these are something that can be done yearly, just to kind of stay on top of things.
Because when it comes to cancer, the sooner you know, the better.
Yes, early detection is key for sure.
So, okay, that is coming up. That's Lunch and Learn. Again, that is on March 25th. Again, let people know exactly if you're planning on going there, because it is a lunch.
Yes, it is a free lunch. So just make sure you get registered again so we have a head count so we know how much lunch we need. This flyer is also on our Facebook, so you can register there, or you can call me at 402-426-1464.
So a busy month ahead. Is there anything else that you guys could be trying to do fit into this month?
Yes, we got a lot going on coming up here soon. One other thing that we are doing, we're partnering with St. Croix Hospice to offer a kind of like an estate planning type workshop. We're calling it Aging with Purpose, Planning for Peace of Mind. This will be on Saturday, March 29th from 8:30 to 2:30. It's kind of a end of life type planning workshop. So we're going to have lots of different speakers from different places in the community to talk about estate planning, funeral planning. We'll have Medicare there to do a presentation. We'll talk about assisted living and long-term care planning, hospice care, all of these different topics and more. Just to kind of get everybody, if you haven't already made these plans, if you don't have that kind of stuff in place, this is going to kind of walk you through all the different things that you should be thinking about and planning for. If you have all this in place, when this happens, when tragedy strikes, you never know when that's going to happen. If all of this is already done, it just takes so much pressure off your family members when they're trying to kind of sort through all of this at a very high stress time. So this is for, all ages, whether you're young, if you're older, if you're middle of life. If you don't have any of this done, if you haven't thought about it, this is a great place to start. And there's going to be lots of people from lots of different areas that you can ask questions to.
Right. Yeah. And I would suggest this for anybody because when the time comes, you don't want your next generation to be learning on the clock.
Right.
Because there is no class to prep that.
Right.
So try to do what you can to make it as easy as possible. So
Yes.
again, that is coming up.
And this is free. Yep, it's
Yeah.
on March 29th. Again, we do ask that you register ahead of time. We are going to provide lunch for this one since it goes a little past lunchtime. So again, just so we have head count of people, but it is free. I do recommend bringing your family members with you for this, just so everyone's kind of on the same page. I think that is helpful. But yeah, it should be a great opportunity, and again, a great opportunity to ask questions.
All right. Again, a lot going on at Memorial Community Hospital and Health System. Again, like you said, you can go to the Facebook page, be able to see all these flyers, be able to register that way. Go to the website, Memorial Community Hospital, MCHHS.org, to be able to learn as well. But first and foremost, let's say thank you, Dr. Moore, and for coming in and being able to introduce and talk about the services that is going right here in Blair. So that way, again, you can get the high quality without having to travel into Omaha, the big city. But it is again for everybody in this surrounding area. Thank you for what you guys do.
Thank you.
Thanks for having us.